Doctors could be on the brink of a breakthrough.
Migraines.
How to control them.
Tame a migraine.
A severe migraine.
Throbbing, recurring headaches.
Given all the noise, navigating the migraine experience can be confusing and scary, but you do not have to do it alone. Welcome to the Migraine Guy podcast, the official podcast of the migraineguy.com and theheadachereview.com. Now, here's your host.
Hey everybody, it's Kevin here, the Migraine Guy. I'm trying to sound upbeat, but I have been beaten down a little bit this week. It was not a pleasant last 72 hours for the old Migraine Guy, and it wasn't just isolated to migraine. Sunday was a terrible migraine, I'll just be honest with you. It was level 9 or 10 for, geez Louise, I don't know, maybe 9 hours, 8 or 9 hours, all said and done, and it was just unrelenting. There was about 6 hours nonstop, maybe 7 hours in the afternoon on Sunday, where from about like 3 until 9, it was just level 9 or 10 pain. And by the time I got home, I had to do some plumbing repair for a family member, and the morning had been pretty migraine painful, maybe level 5 or 6, but then it started dissipating. So I hadn't taken a triptan yet. I hadn't taken I had taken my Trokendi, of course. I have to take that every day at the same time, but I hadn't taken the Triptan. I hadn't popped into Proxen yet, because I was trying to gauge whether or not this was going to be an intense migraine, if it was going to break. And then once it started breaking around noon, I felt like, oh, okay, this is just a stupid morning, but it's gone, so we can move on with the day. And then after the plumbing was done, hit me full force out of nowhere as I was driving, actually, which was pretty annoying. So I didn't really have a chance to hit a Triptan, didn't have a chance to get any sort of OTC pain relievers in me. And so then it was just survival mode for Sunday. Monday I had super intense low back pain, which is somewhat frequent for me. Maybe once every 6 months I'll get it, but it's almost every time been correlated, at least for the last 4 or 5 years, with me lifting a certain amount of weight. I like power lifting, I like lifting heavier things, and so it's almost always been when I've tried to go for something somewhat heavy, for me at least. I'm not at all like a professional power lifter doing anything that's impressive to professional power lifters. But when I've done things that have been heavy for me, I have occasionally resulted in back pain, in the same area, and so I just always thought it was related to that, and then I'd rehab it on my own, do certain stretches, certain workouts, and it would go away every single time, and it wouldn't come back for 5 or 6 months. So I thought I was fine, and that's how I felt Monday, although I hadn't done it with working out, which was weird. It was kind of a weird red flag for me, but the pain went away towards the end of the night, and as I was sleeping, I woke up a couple times to toss and turn or whatever, and the back pain I noticed had almost completely gone, which was great. I was very excited about that, and it just seemed like par for the course, normal stuff. But then Tuesday hit, and Tuesday my right leg went numb at about noon, and that was terrifying. I had about maybe a level 3 to 5 on the back pain, but that was so much reduced from the pain I had felt the previous day that as I was walking around and doing work on the house, that I just thought, well, it's going to take a couple more days, then it'll be back to 0 and things will be fine. But then at noon or 1, I noticed that my leg was, it felt like, how your limbs go to sleep if you angle them weird or whatever. That's how my right leg felt when I was standing perfectly vertical. And then I sat down, I rubbed it, I took, my sock and shoe off and started rubbing it and stuff, trying to just get as much circulation flow as I could, thinking that I had somehow obstructed circulation. In the back of my mind, of course, I was worried this was some kind of stroke or something, but it was so gradual that it didn't seem like a stroke from what I know about strokes, and it just kept going on over the course of an hour or so. And so I called my wife and I said, I gotta go to the ER. My right leg's mostly numb. I could use it. That was the weird thing. It felt like it was asleep, but I could still fully use it. I could place all my body weight on it. I could do things with it, but there was just such an intense numbness to it and coldness to it that it was so weird that it seemed like it was justifiably an emergency type event. So went to the ER. got admitted, didn't see a doctor for 3 hours. It was really upsetting. They came in and apologized a bunch of times because they forgot about me. But sorry for yelling. Still upset about it. So they came in eventually, ended up getting an MRI for my back. Turns out there's a bulging disc between L5 and S1. The vertebrae is there, which is putting pressure on the nerves, which correlates the nerves that would be affected by that bulging disc perfectly correlate with the numbness that I'm feeling. So it's pretty clear exactly what's going on. It wasn't bad enough that they wanted me to get surgery right then, which is good because, I mean, God knows how much that would have eventually cost us. Yeah, so the symptoms for severe emergency surgery needed would have been like pelvic numbness, inability to control my urination and bowel movements, or if my foot was actually dragging, kind of like a sledgehammer on the ground, like if I couldn't lift it, if I had no muscular control. Thankfully, none of that was the case. And so the main ER doctor who had been talking to us went to get the orthopedic doctor who was on call, came in, talked to me for a bit, said what the surgery options were, said he didn't want me to have any sort of pain medication besides over-the-counter stuff because he didn't want me to become addicted or overdose to opioids and narcotics, which if you listen to last week's podcast, which you should, you would know is probably BS. Not BS like he was lying to me, but BS because the statistics don't support it. But he left again after giving me kind of the rundown on the surgical procedure. And then the main doctor came back in, told me that since it wasn't an emergency, wasn't something that needed to get fixed right away, that I should get in, i.e. make an appointment with the main surgeon in the department to discuss the options over the next couple weeks. She prescribed a steroid to help reduce the inflammation for the next week. It's a 7-day steroid. You taper down, you start at a certain number of pills, and each day it reduces by 1. And that's been the plan for the next week at least, and I'm feeling better. I am feeling better. My right foot is still slightly tingly and numb. My calf, interestingly, feels like it has the worst Charlie horse I've ever had. So if I try to walk normally, it feels not excruciating, but terrible. And so I've got this really, funny looking limp going on right now. So I'm just a mess. I'm just a mess right now. But that's what's going on for me. What else is going on? The Trokendi, let's see, for the migraines. I'm still taking that. Haven't, seen a reduction in the frequency of the migraines yet. But, most studies show that it can take between a month and 3 months to actually see the full effects of topiramate in either full dosage or time release. And so I might have to wait the full 3 months to really give a fair verdict on it. But so far, not seeing any negatives either, which is the most important thing. The Trokendi, if you remember from previous podcasts, is the time release one, which is what I wanted because it being time released means that it's not just dumping all the topiramate into your system at once. It is releasing it slowly over time. It's time released. And so I was excited about that because topiramate has a pretty good track record with reducing migraine frequency, and my neurologist was very desirous to get me on it because he has seen a lot of good results with it, and so that was the compromise that we came to. And so that is still going on. Haven't seen a reduction in the migraines and have seen a few pretty bad ones in the last couple weeks. I doubt that it's at all correlated with the Trokendi, but I just have had a couple bad ones, specifically last Sunday. So that has been a bit of a bummer. So kind of just a crummy, painful week. Thanks to everybody who has wished me well on social media. I don't post these things because I want to whine. I'm a human, so there's part of me that wants to whine into the internet vortex and be validated. But I definitely want the posts that I do that are more subjective and personal to connect with you in a way that helps you know that you're not alone and helps me, when you respond to me, feel like I'm not alone, and that connection is really what I'm going for. And I certainly don't think that I am at all like a worst case scenario. I know so many more people in our Facebook support group, the Migraine Guy support group, that have it so much worse than I do. And so I don't ever want to come across as whiny or looking for attention, but I do genuinely appreciate when I post the more subjective first personal stuff, all of the very kind and supportive comments. And I hope that everybody who posts stuff like that in relation to their chronic pain or their pain issues gets that kind of support. So thank you to everybody who has reached out. I don't want to name anybody by names because sometimes there's intimate details about their own life involved in what they're comforting me with, and so I don't want any of that to come out, but I just want there to be a general thank you to every single person who has reached out on Instagram and Twitter and Facebook and YouTube and been very kind in their words to me. So that being said, that's enough of Debbie Downer stuff, enough of all the negative stuff that's been going on. Let us get to some positive migraine news. All right, this week's bit of positive migraine news, and I do promise that this is going to be uplifting as opposed to that intro about myself. Sorry for the little bit of Debbie Downer and a very lengthy intro, too. It was like 12 minutes. But this week's bit of migraine news comes to us from way back in 2012, and the title of the study was Lavender Essential Oil in the Treatment of Migraine Headache, a Placebo-Controlled Clinical Trial. Now, if you're not familiar at all with essential oils and their use with migraine headaches, this study is one in a not a super long history of it, but there are a decent number of studies that have looked at essential oils' efficacy in reducing a given migraine's intensity and pain. And so this study is looking at whether or not lavender as an essential oil can be used as an acute management option for migraine headaches. The study looked at 47 patients with a definite diagnosis of migraine headache and divided those 47 into two groups, a control group and a test group. The test group inhaled lavender essential oil for 15 minutes, whereas the control group simply inhaled liquid paraffin for the same amount of time. Both groups were asked to record their headache severity and associated symptoms in 30-minute intervals for 2 hours. So they gave 4 reports over the course of the study. What they found was that the group that inhaled the lavender essential oils responded overwhelmingly positive, whereas the paraffin group did not. And so the study is obviously very small, as many migraine studies are, since there isn't a lot of funding for it. And of course, not everyone is going to enjoy lavender, etc., etc. There are a lot of faults with the study, a lot of limitations. But the important point is that one, things that are readily accessible, like essential oils, do have a pretty good track record, as this particular study shows, as being a way to help combat your migraine pain when you're in the midst of a terrible migraine. If you were able to suffer through all 12 minutes of the intro, I actually forgot on Sunday that I have essential oils from LaPixie is actually a website that you could check out, lapixiewellness.com. She sent me a bunch of sample stuff in order to do reviews about her stuff. You can check out some of the reviews on the YouTube page. And I did notice when I was using her stuff regularly a huge difference when my migraines hit than when I didn't use it. So I actually need to break out that stuff, because on Sunday when my migraine is horrible, it would have probably helped quite a bit. But the important thing is that essential oils are very common now. They're ubiquitous. You can go to the grocery store and buy essential oils now. And so pick your essential oil. The study looked at lavender, but lots of people respond well to many different kinds of essential oil. So find some that smell good. And what you can do is, if they don't come with a little roller ball, kind of like a little mini deodorant stick, if it's more like a little dropper, you can just put a couple drops across like your collarbone, maybe right underneath your nose on your top lip, and just slowly inhale it. If you find that that's too potent, another thing you could do would be to perhaps get a big pot of water, If you like the idea of hot water, you could boil some water, get some hot water on the stove, put a few drops of the essential oil in, and put your face over the pot. Not directly over, you don't want to get steam burns or anything, but over it enough that you're inhaling it and having the heat provide a little bit of heat therapy to your head. Now, if that doesn't feel good, don't do it. But of course, it's just another way to get the essential oils in. So there's a variety of ways to do essential oil therapy. I prefer just dabbing it across my collarbone and my upper lip and slowly inhaling it that way. And this is great for a number of reasons. One, we're in the holiday season. If you have someone in your life who gets migraines, or you're a migraine sufferer yourself, and people are asking you, well, what can I get you for Christmas? I want to, help you. And maybe you already have a couple ice devices. Maybe you don't need any money for medications or medical bills. Essential oils could be something that you could look into getting to see how they work when you do get a migraine. Additionally, they are easy to test. You simply get a little vial, and when your migraine hits, use it. And if it helps, and you'll notice if it helps almost immediately from my own experience and the many people that I have talked to, it's almost instantaneous whether or not it helps, which is why the study only looked at 2-hour time frame. It's pretty quick that you notice that you notice whether or not the essential oil is helping you or not. Now, it's not exactly clear, right? This study didn't look at why it helps. I know from my first person experience, my subjective experience, when I am inhaling essential oils during a pretty crummy migraine, for whatever reason, the eucalyptus or the lavender or whatever you're inhaling just calms me. I don't know what it is. It's just the deep inhalation of a pleasant smell calms me down. It makes me actually take deeper breaths because it's pleasant to breathe in. Of course, I'm breathing in mostly through my nose at this point to get the aroma. But that means that I'm breathing in deeper and slower, which is helping get more oxygen into my bloodstream. It's slowing down my heart rate a little bit, which is regulating the amount of blood that's pumping through my body, which means I'm reducing the amount of pulsation feelings that I have with my migraines. I get really intense pulsings, which most migraine studies show is correlated to vasoconstriction and then blood pulsing. So the slower your heart rate is, the less intense those are. And so there's a number of theoretical values to using the essential oils. But what these studies at least show is that they're effective, even though they don't pinpoint any one or multiple reasons why. And so they're inexpensive. They're very easy to get a hold of. They're ubiquitous in society, and they're easy to test. And so I think these are really great, not only holiday gifts, but a very low risk option for migraine sufferers. Now, there are, people who are allergic to essential oils. You probably want to make sure that you're getting a brand that has a good reputation, because who knows what goes into some of these oils. If it's a cheaper company or someone just trying to make a quick buck, you definitely want to get a good essential oil. So you need to be doing a little bit of research about that. But as I said, there are good companies out there like LePixieWellness.com, as well as others that do a good job of sourcing their oils appropriately. So make sure that you look into that factor. But overall, it seems like essential oils are a great option for migraine sufferers to use, to have in the old toolbox when you're in the midst of a migraine. So make sure to check it out. Make sure to let me know how it helps you, if it helps you, on social media. All right, this week's migraine tip of the week has to do with what you can do to help reduce your migraines during this holiday season. There is a ton of things this holiday season that could either be sources of great memories and tons of positive experiences, or could be a potential minefield for you and your migraines. And navigating that minefield is very important. So what can you do to succeed this holiday season? Well, the first thing that goes without saying, holiday season or not, is to plan. For example, you need to be asking yourself questions such as, what days do you need to go to certain places? Do you need certain clothes clean? Do you need gifts bought and wrapped on a certain day? Do you need a particular ingredient from a particular store for a certain recipe that you have? Using a calendar or notepad to have each day's to-do list planned and stated explicitly will help avoid last-minute stresses, and this will reduce the amount of migraines that you would have had you introduced those stresses otherwise. Moreover, when you plan each day, you avoid last-minute shopping. Crowds means close quarter shopping, and this means lots of odors. Olfactory triggers for migraine will be made worse in cramped, stressful stores with people smelling of that special perfume or cologne or body wash that you know triggers your migraines. Additionally, if you're a student, then on top of all of this stuff to worry about, you also have studying and exams to worry about. Planning study time each day will reduce the amount of last-minute cramming you feel compelled to do and will help you not only study more, but sleep better. Nothing is worse than taking an exam with a migraine or trying to study with one. You don't want to have to be the student that comes up to the instructor or professor after the fact and says, well, I wanted to study or I wanted to do this exam well, but I had a migraine, because then it starts to sound like an excuse unless you have a track record established with that professor or instructor. It's better to try and take steps beforehand to avoid the migraines altogether. Finally, make sure that you try to keep as much of your normal routine implemented as you can. For example, if you are heading over to grandma's at 3 p.m. to eat a big meal, that does not mean that you should skip breakfast and lunch to, quote, make room. Instead, you should eat your normal meals at your normal times, your breakfast, your mid-morning snack, and your lunch. This may mean that you eat less of grandma's delicious stuffing, but at least you will not have given a migraine an opportunity to ruin the entire day. What are your migraine tips this holiday season, listeners? Tell me on Instagram, Twitter, and Facebook with the hashtag #MerryMigraine, and I may feature it on next week's pod. But that does it for this week's Migraine Tip of the Week. All right, everyone. I guess we are pushing the length of the podcast from the 20 minutes that it used to be to closer to 30 minutes now, I guess I just am getting more comfortable chatting you all up. I hope that is okay with you, but thanks for listening. If you made it this far, I really do appreciate you listening to each and every podcast. There are a growing number of migraine podcasts out there, and I just want to thank you for listening to this one. If you haven't given me a 5-star review on iTunes, what the heck are you doing, man? Come on, man or woman. Why don't you head on over there and hit that 5-star button? Leave me a review. I will listen to the review if it's positive or negative. If you want to hit me up on social media, just look up the Migraine Guy on Facebook, Twitter, Instagram, or YouTube. I've had a couple people do it this last week, saying that they either just found the podcast or just found the YouTube page or just found the Facebook page and were feeling lonely or feeling isolated, and it was helpful to hear from someone who was similar to them. And so if you're in that position, please reach out. You're not alone. I have a Facebook support group. Just search the Migraine Guy support group. We're inching towards, I think, 1,100 members right now. It's getting kind of big. But we have a very, very active and supportive community and a very, very strong moderating group in our community that drops the hammer on anyone who tries to take advantage or sell snake oil to you, sell you any sort of cure. So we try to keep everything in there motivational and supportive. That's the purpose of the group. Nobody tries to make a buck off of you. Nobody tries to abuse the group. It's all very protective and it's private, so nobody sees what you post there. If you're worried about coworkers or family members seeing things, they can't unless they are a member of the group. So another thing to think about there. Other than that, I hope you all have a nice holiday season. I know the main holiday here in the States anyway is Christmas, but there are plenty of other holidays out there being celebrated. Or if you're just getting together for family time, please enjoy it. Everybody who is a chronic pain sufferer, when you get a break from the pain and can just enjoy life. Those are the reasons that we fight the battle that we're fighting. At least it's the reason I'm fighting the battle I'm fighting. I value the time with family and friends. I value the time with people who I care about when I'm not in pain. And so I look forward to those moments. And if they coincide with culturally important or religiously important holidays, then all the better for us. So I hope you all have a really good time. If you don't, it's okay, and that's very important. I could have a crummy Christmas. I could have a crummy New Year's. I could have all that be terrible. I don't expect to have a good one, but I really hope that I do, and I really hope that you do as well. But if I don't, I'm going to be in my support group. I'm going to be back here next week talking to you. I'll be on the YouTube page putting up videos. I'll be on Twitter posting news. I'll be on Instagram sending pictures from the hospital. That's what we do here at the Migraine Guy. So that's what you can expect from me. If you're not following me, I hope you will, and I hope you'll let me know how you're doing, because I genuinely care about you. And why do I care? It's because you are not alone. If you want to help keep everything that the Migraine Guy does free, then you can become a patron over at the website patreon.com. That's Patreon.com. Patreon lets people contribute funds to other people whose work they value. Becoming a patron does things for me, such as allowing me to buy new products so that I can do product review videos so that you know whether or not a given migraine product actually works before you buy it. It also helps me do things like upgrade the microphones and cameras for both the YouTube channel and this podcast. And more importantly, it helps me be accountable to you, my migraine community. You can pledge as low as $1 a month if you want to, and every single dollar does help. Just head over to patreon.com/themigraineguy to become a patron today.